Hello everyone, my name is Hadiel Zainal, a student nurse from Davao Doctors College. And today I'm going to perform the Leopold's maneuver return demonstration. So Leopold's maneuver, it is used to palpate the gravid uterus and to determine the position, presentation, and engagement of the fetus inside the uterus. So prior to the conduct of the procedure, first we need to prepare the necessary equipment. And the equipment needed are, of course, the pillow, a towel, and the stethoscope. And before doing the assessment, don't forget to perform hand washing to prevent the cross-contamination and to deter the microorganism. Hello, Mom. Good morning. My name is Adil Zainal, your student nurse for today. May I see you, Wisban, Mom? Please state your complete name. Alright. And your birthday, please. Okay. So, Mom, how would you like me to call you? Alright. So, Mom, today we will be doing the Leopold'S maneuver. It is the easy method to determine the presentation and the position of the fetus inside your uterus. And later on, I'm going to palpate and touch your abdomen. Is it okay with you? Alright. So, Mom, as you can see, I close all the curtains to provide and protect your privacy and confidentiality. So, do you feel comfortable right now? Alright, thank you. So, Mom, is it okay with you if I close the door so that no one from outside will disturb us while doing the assessment? Okay. Okay, Mom. So, without further ado, let's proceed to our assessment. Okay, Mom. So, before we begin to our assessment, I encourage you to void first so that later you won't be uncomfortable while doing our assessment. Okay, Mom, you're back and you are done voiding. Now, position the patient on a supine position with one pillow under her head with her knees slightly flexed. Okay, Mom, I need you to lie down and slightly flex your knees. And Mom, I need you to turn to your side and I will put a towel underneath your hips, okay? Alright. We are going to begin. Now I will be exposing your abdomen. Okay, so begin the procedure. We will be going to expose the area of the examination. And if you are in the right-handed, stand on the patient's right. And now, let's begin to the first maneuver, which is the fundal grip. So face the patient and palpate the uterine fundus to determine what is the part of the fetus lies in the upper part of the uterus. Now I'm going to create a triangle and I'm going to palpate the uterine fundus to determine what part of the baby or of the fetus is in the upper part of the uterus. Alright. So now, let's proceed to the second maneuver. Second maneuver called the umbilical grip. So, um, in doing the umbilical grip, we need to palpate in downward direction on the side of the abdomen. We're going to palpate downward and apply a gently but deep pressure to determine the position of the fatal extremities or the fatal back and the anterior shoulder. Okay. Lima. Alright. So now let's proceed to the third maneuver. So proceeding to the third maneuver, which is the Leopold'S grip, we need to place our one hand over the symphysis pubis and grasp the lower uterine segment between the thumb and the fingers to feel the presenting part. Okay. Okay. Now proceeding to the fourth maneuver, which is the pelvic grip. This is done to determine the findings of the third maneuver. And now turns and face to the women's feet. Now and determine the flexion of the vertex. Alright. Okay. Now that we are done with the maneuvers, we are now going to locate the fetal back again and the fetal heart tone of the baby inside the uterus. Okay, mom, we are done palpating your abdomen. Now I'm going to listen the heartbeat of your baby, which is the normal heartbeat is 120 to 160 beats per minute. And now I'm going to listen the heartbeat of your baby inside your uterus in at least full minute. Are done with our procedure, and now I need you to cover up. Okay, so are you comfortable now? Alright, mom, thank you. So when I determine your baby a while ago, your baby is at your right side, and that is in a cephalic position, which means the cephalic is the head of your baby is in the lower part of your uterus. And also when I'm listening to your baby's heartbeat, I counted that your baby's heartbeat is 130 beats per minute, which is normal. Okay, mom. So thank you for your cooperation today, and now we're done doing the assessment to our patient. Also, don't forget to perform hand washing and document the findings.